Thank you very much, Tom. This is awesome. Wow. So I'm going to start out by saying, what do children need? Well, it's pretty obvious. They need food, they need shelter, they need clothing, they need love, but they also need an education. They need access to health care, and they need all the things that help to promote good health. Health in the broadest sense is what I'm talking about. We heard yesterday at a fabulous presentation with toxic stress that our children face challenges that affect every aspect of their lives. Poverty, poor nutrition, many other toxic stresses. I'm going to quote somebody you wouldn't expect to hear from, Harry Houdini. Harry Houdini said, "What the eyes see and the ears hear, the mind believes." So I think this is a great description of how kids learn and how they develop. But our children who are suffering these adverse childhood experiences are not living a life of illusions, such as Harry Houdini put on when he did a great show. They are seeing and they are hearing stresses that have an early, profound, and lasting effect. We as pediatricians in our academy have been in the forefront of addressing these stresses. Now, I know many of you have been in and are still in the trenches. And as you know, some days in our offices and our clinics, we're not just physicians. We're nurses, we're social workers, we're pharmacists, we're health insurance advisors, we're nutritionists, we're accountants, we're teachers, all in the interest of trying to change for the better what children see and hear. And I also know that many of you make time for advocacy for children, working for system change. Advocacy is a team sport. Those of you that do it know that, and those of you that will be doing it will find that out. We do it every day in our offices, we do it every day in our communities, and we also do federal advocacy. We're trying to change public policy, we're trying to change laws and rules that affect really broad changes within the system. Now, we can be strong advocates to make sure that kids have access to care and appropriate essential health benefits. If, and unfortunately it may become when, the health insurance goes, but benefits for children will become part of the health insurance exchanges and are no longer part of the Children's Health Insurance Programs, or CHIP. You're going to hear me talk about CHIP again because I'm passionate about that. I spend a fair amount of time speaking to legislators to prioritize children's needs. I want funding to continue. No, I want funding to increase significantly for the programs that have proof of effectiveness for kids. Thanks. Programs that will improve what kids see and hear. Things like WIC, early intervention, home visiting for mothers and babies. We need federal policy to address practice transformation, e-cigarette regulation, opioid abuse, vaccine refusal, gun control, drug pricing, graduate medical education reform. Just stop me. There are so many issues. Thank you. But let me not forget some of the wins that we have had. So we've had some major wins, like the Affordable Care Act. Whether you like it or not, the Affordable Care Act, whether you like that or not, the Affordable Care Act has provided access to care and insurance for more people than ever before. And also for the CHIP Reauthorization Act. Yes, my favorite. As you know, CHIP was extended until, funding was extended until 2017. But as I said, we can't stop there because CHIP is with us until 2017. Then what? There are just so many issues. This past summer, as Fernando had mentioned, we went to the district meetings. It was a whirlwind of activity, and I had a chance to meet many of you there and to hear your many concerns that affect us, our patients, our practices, and our academy. I certainly heard that we as pediatricians have our own challenges. Reform payment methods, limited networks, and here we go again, CHIP reauthorization, and these are just a few. Some of these changes can disrupt the doctor-patient relationship and the medical home. Think telemedicine and retail-based clinics. The hopeful perspective is that where there's a challenge, there's opportunity. We know children best. For us to succeed in meeting children's needs, we need to address our own concerns. We need to ensure that we, primary care, specialty, subspecialty, whether you're in a small independent practice or a large integrated system, have the knowledge and resources to continue to provide the care for our most vulnerable population. We need to be nimble with different payment models. We need to offer virtual visits, partnering with retail-based clinics and telemedicine companies to maintain continuity of care for our patients. And similarly, we need to find ways to increase revenue to support all of these efforts and to remain in business. Parents want the convenience of after-hour availability. Well, we've been doing this for years, for free. Making ourselves virtually available for parents and our patients when our real offices are closed and include payment for this service is one way to increase that revenue. And perhaps local partnering with those retail-based clinics would offer our consultative services to the corporate entities that operate these centers, and we could provide clinical knowledge and also knowledge of our community. On the federal level, the Academy needs to remain a strong voice and continue to collaborate with other organized medical associations. The Centers for Medicare and Medicaid, CMS, respond to physician concerns, especially when presented by a unified front of physicians working together. So going back to my original question, what do children need? They need us. They need us. Don't ever forget how important you are to the children and the families that you take care of. How many of your patients have your picture in their baby book? How many times have you watched a parent text or call with the height and weight on a baby at a well baby visit in your office? Do you realize how many times the topic of conversation at dinner? So what did he or she say about the baby? Did you ask her about that thing on his face? What about that daycare she's going to? Is that okay? Did she think that was okay? You are incredibly important to the children in your practice, and that is why you do what you do. We have earned the respect of our patients, our communities, and local, state, and national legislators. We pediatricians have a reputation for fairness, and we focus on the right priorities. Yes, indeed, our children need us. Thank you.